Hello, I'm Dr. Maurie Markman from City of Hope, and look forward to presenting this very interesting paper that appeared in BMC Cancer entitled Health-Related Risk Behaviors Among U.S. Childhood Cancer Survivors, a Nationwide Estimate. This is really quite an interesting topic. I think we all know that one of the great success stories in cancer management has been, in fact, the ability to effectively treat childhood cancer. Obviously, the major story there, of course, is childhood leukemia. Probably less well discussed is what happens. The cancer has been cured. Obviously, the child will go to an adult. What about the long-term outcomes? And of course, there's been studies that have looked at questions of the morbidity, even early mortality related to even the treatments. But this particular analysis looked at risk behaviors. Basically, a behavioral risk factor surveillance was done, looking at 372 individuals who were, in fact, long-term survivors, childhood cancers, compared to 1,100 healthy controls who were matched for age, sex, residency, where they lived, race, and ethnicity, and very interesting outcomes. First of all, they looked at questions, risk of binge drinking, very similar between the two groups. However, they found that the childhood cancer survivors had a much higher, in fact, in my opinion, disturbingly higher risk of being smokers, 26.6% compared to the healthy control population, as they defined it, of 14.4%. So in other words, 1 in 4 of these individuals who were survivors of childhood cancer were smoking. Obviously, the potential risk there of other cancers is real and maybe even higher because of their prior treatments. Also, it was noted that physical inactivity was higher, 23.7% versus 17.7%. And in fact, if one looked at 2 or 3 risk factors in this population, it was 17.2% versus 8.1% in the, again, healthy control population. And individuals who had multiple chronic conditions, may have actually been related to their cancer or its treatment, had a much higher risk of risky behavior. Clearly, very complex topic, but one that cannot be ignored. And certainly when one looks at the question of, is there something we can do to prevent these risk factors, smoking comes to the top of the list. Very interesting paper, a very interesting analysis, clearly not the end of the story. But I think it's important to emphasize just how important it is to understand what happens to the long-term survivors of childhood cancer, because these are our incredible success, incredible important what we've been able to accomplish as a cancer community. But we also have to look at what happens to these individuals when they leave the confines of the treatment area and they become long-term survivors. That cannot be forgotten. Thank you for your attention. I, again, encourage you to look at this paper and consider the issues that it raises.